I'm Kenesha Clark. I am going to do my physical examination assignment for NR 305.
I'm Avery Clark, and I give my permission for this recording to be submitted to Chamberlain University Nursing Program.
Okay. Now I'll scan the room. And now we will get started on Avery's head-to-toe assessment. Avery is a 19-year-old male. How are you doing, Avery?
Good.
My name's Kenesha Clark. I'm going to be your registered nurse today. I'm going to help take care of you. I'm going to perform a head-to-toe physical assessment on you. So I'm going to get started by washing my hands. All right, so I'm going to ask you a few questions, Avery. Can you state your name and date of birth for me?
Avery Clark, and I was born June 21st, 2001.
Okay, Avery. And where are you at?
The doctor's office.
Okay, and what are you having done today?
An examination.
Okay, so Avery appears to be alert and oriented ×4. He appears to be average height and age. He also, his body is, build is supporting him. His contour is good and appropriate. He's well nourished. His facial expressions and his affect are appropriate for the situation. There appears to be no physical deformities. He doesn't appear to have any distress. He is appropriately dressed for the situation, and his speech was clear. So overall, I'm going to take a look at his skin. He's warm and dry to the touch. His skin has no lesions, no rashes, no tattoos. He's non-tinting. His skin color is appropriate for ethnicity. I'm going to take a look at his nails. They're nice and short and clean. They're pink. The contour is good. There's no clubbing. Do the capillary refill. It's less than 3 seconds. So I'm going to check his brachial pulse. His brachial pulse appears to be equal bilaterally, +2. I'm going to go down and check his ulnar and radial pulses as well. They both appear to be equal bilaterally and +2. Then I'm going to start with Avery's head. So his head appears to be normal, cephalic. I don't see any lesions. His hair is nice and thick. There are no bald patches. There's no signs of infestation. So we'll move down to Avery's ears. They're symmetrical. They're not red. They're not tender. There's no drainage. He doesn't have any piercings. There's no swelling. So I'm just going to take a look inside. There doesn't appear to be anything inside Avery's ears. And as we noticed, Avery answered my question, so his hearing seems to be intact as well. So we're going to move down to his nose. Avery's nose is symmetrical, midline. There's no flaring. There's no lesions. Tilt your head back just a little bit, Avery. We're going to look up your nostrils. There's nothing that's obstructing in there. So Avery, I'm going to have you to close one nostril at a time and breathe. And do the other one. He appears to have bilateral patency in his nostrils. So now we'll take a look at his eyes. His eyes are symmetrical. They're even. His eyes and ears are even. The conjunctiva in his eyes is pink. The sclera is white. There's no drainage. No signs of infection. His pupils are black and they're round. They look equal. So Avery, I'm going to shine my pen light. They're reactive to light. Follow my pen. And they're accommodating as well. So now I'm going to move down to Avery's mouth. His lips are pink and moist. There's no cracking. There are no lesions present. So can you open your mouth for me, Avery? His gums appear to be pink and moist. His buccal mucosa is pink and moist. There's no odor. Say ah for me, Avery. So when Avery says ah, his uvula is midline and it rises. His tonsils are still present. His teeth are intact. So now we're gonna move down to Avery's neck. It's midline, symmetrical. His trachea is midline, no signs of deviation. We're gonna palpate his lymph nodes. There's no sign of tenderness or lymphedema noted. We're also going to, gonna have you open and shut your mouth, Avery. We're gonna check his temporal mandibular joint. That seems to move with ease. So Avery, I'm gonna have you look up and down, side to side, and around. Avery appears to have full range of motion in his neck and in his spine. So the next thing we're gonna do is look at his chest, posterior and anterior. When Avery's breathing, his chest expands symmetrically. The configuration and shape look normal. There are no signs of deformity. So Avery, I'm gonna check your lungs in a few places. So when I put my stethoscope to you, I want you to breathe in and out. If I'm moving too fast, let me know. Don't want you to pass out on me. Okay, take a deep breath. Now listen to your back. Okay, when Avery breathes in and out and I listen to his lungs, they sound regular, unlabored, they're equal bilaterally. He has no use of any accessory muscles, and there are no murmurs noted, no adventitious breath sounds heard. So now Avery, I'm going to listen to your heart in 5 places. You do not have to breathe in and out for this exam. So first I'm going to listen to the aortic. Then the pulmonic. And move down to the Erb's point. Over to the tricuspid valve. And then mid-clavicular line. All right, all of Avery's S1 and S2 lub-dub sounds are heard, and there are no murmurs present. So Avery, I'm going to have you lay down on the table so I can inspect your abdomen. So Avery's abdomen appears to be flat, no distensions, the contour is good. Avery's umbilicus is midline where it's supposed to be. There's no redness or swelling. So now I'm just going to take a listen to all 4 of his quadrants for bowel sounds. All 4 quadrants of Avery's bowel sounds are present and active. Avery, now I'm just going to palpate on your abdomen and tell me if you have any tenderness in those areas, okay? Any tenderness?
No.
So Avery has no tenderness, no guarding when I touch his abdomen, and no masses present either. So while Avery is continuing to lay down, I'm going to go down and check his pedal pulses. Those feel equal bilaterally, +2. I'm going to go in and check his tibial pulses. Those feel equal, bilateral, +2 as well. So Avery, I'm gonna have you sit up for a moment. Make sure you don't get up too fast so you're not dizzy. I'm gonna have you stand straight up. Put your arms down to your side and close your eyes. Avery's not swaying at all, so his Romberg test is negative. Now Avery, I'm gonna open your eyes and walk forward just a few steps, heel to toe, and then back. All right, Avery's balance is good. Avery, just touch your fingers to your nose. And this concludes the assessment, head to toe assessment for NR 305.